Okay, any other questions, Gary?
No, that's all I had. Thank you.
Anybody else?
Just one quick comment on the newsletter piece, the staff corner. I think Brady, you put this together. I love the write-up, but I didn't have any idea what Carrie did within the organization.
Oh, she's an MA, yeah.
Yeah, she's an MA in our clinic. And she actually helped with the implementation of the referral process above and beyond.
Okay, thank you.
So adding titles to those.
Yeah.
Can help you guys.
Yeah, yeah.
We should do that.
I would like the board to, on my report, just to take a look at the graph and notice what our volumes are doing.
I did look at that. It was pretty impressive. Over the green line, right? Is that the green line?
It's above the green line, and the
Yeah.
green line is what we're chasing. So I just want to make that,
You bet.
you know, that Brady is doing a cut-up job. We're doing great, so.
Okay.
Brady.
Okay, that would, Chelsea has a report that she is gonna give us real quickly. So Chelsea?
Okay, so, the board is gonna ask him a lot of questions about marketing, especially marketing to our second homeowners, visitors, tourists that are up in the area. So we've been listening and we've been in the background doing work to increase that and improve that. And so what I did, so we're gonna focus on just that section versus everything, just in the time. I gave you guys a graphic, but so we're working on targeting our primary audience right now is the second homeowners and visitors around the lake. So for the summer season, that is the next target area. Our second dairy target area is the local community members throughout the basin. So that's always a target area, but we're definitely putting an emphasis on second homeowners and visitors. So we're gonna, the goal is to increase brand awareness, location awareness, and generate more leads for patients and for us. So this graphic kind of shows you kind of the steps of how we get there. So there's the value proposition, which basically just talks about, we want to bring further awareness to Seneca. And we want to bring it in a positive light so that when someone Googles, I need a hospital when they're visiting the lake, we come up and we have a good star rating, so they want to come to us. So all of these steps that I'm going to go over on the back of the visual that I gave you, these are the steps that we're working to implement. So geofencing is one of them. Geofencing will essentially target people in a radius. So geofencing is not cheap, it is expensive. But what it will do is we can set that we only want to do this June and July, or June, July, August, depending on what we decide. So the idea is to do like a shorter campaign and look at the analytics and see, okay, does this help? The geofencing will target a bubble around a location is essentially what we'll do. So we'll target this lake area this summer. Radar 8 is something that should be going live anytime. IT has been working very hard on building a module that we need for it. What Radar 8 will do is it will help promote us getting all of the reviews that we need, because you Google a hospital and it's got a 1 or 2 star rating online, you're gonna go, I might just drive home and go use the hospital. And it's not that our facility is bad, it's that typically people only review facilities when they were upset. And so this will promote people to review us even regardless of whether they're upset or not.
Prompts them.
Yes, it prompts that
Yes.
review, so then they just click on their phone, oh, 5 stars, and their service is great, and it will help that star rating go up, which will help people, especially second homeowners and visitors, feel more comfortable with utilizing the services. Email marketing, so we're increasing our email marketing, which will utilize different lists that we have internally as well as externally through services that we use, and with Cerner. So with Cerner, we should be able to utilize that marketing, but that will be more of, there's certain regulations that we have to do with that. So that's more like, oh, it's flu shot season, so we're gonna let our patients know that it's available, things like that. So those are things that we're working on increasing. Events and social marketing, so we are going to kind of have a larger presence at the local throughout the area this year. So I'm working out with the city about, and we have 2 band shells that we are actually sponsors of this year for the country club. But the goal is to also have a presence of everyone. So we're working out like logistics of how does that look? Does that look like us having a poster and a banner there, or whatever it may be? So I'm working with Catherine Sampson on that. We're talking about farmers market, craft fairs, all of the kind of larger events, fun runs, triathlons, so all of that, we are working on having a presence, whether it's from a volunteer aspect or even just more signage at those events. And then increased product marketing, so some of the increased product marketing will be things like, we're 29 minutes, that will have, here's the internet name, and here's the password, and then it'll have Seneca's information. Those will be given out to all of the second homeowners that rent their houses as Airbnb, so then it helps get our information out.
What's the first thing that people look at when they go to a VRBO? What's the internet passcode?
Right.
We're gonna put our name right there.
So it'll be essentially like a whiteboard where they can write on it with a marker, but it's magnetic, and then it has our information on it.
I think that's a great idea.
Yeah.
It's a safety issue.
She's brilliant.
Right, so, and then the last one is existing, so that's just all the existing stuff that we will still continue to do, which is our social media, our radio ads, our marketing, all of that, but we are definitely, working on trying to reach all of those second homeowners, make sure they not only know where we are, who we are, and what.
How about our quality data reporting, like CMS.gov and, I mean, are those
Yeah.
gonna be published or?
So we can, yeah.
All right, well, I don't.
Yeah, we can publish those, so a lot of that stuff is readily available online, but we can start adding that to the website as well, which will help it pop up quicker or more easily when someone searches us on Google and things.
People are very savvy.
They are,
They-
yes. But, and we actually do have good ratings for our quality.
I know, publish.
Okay, we can add that. Anything else, any question?
Only thing I would ask is if, as we increase our presence at other local things, do we have things that identify that that person is volunteering from Seneca to help hand out blah, 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 or
Yes,
whatever?
so like, for example, the community suppers is one that we've been doing, we have aprons that have Seneca's information on it, we have jackets, sweaters, hats, things like that.
Good.
And then some of these events, we will actually set up tables with flyers, banners, and all of that.
Just have to say that the first community supper that we did, it was a blast.
Right.
I mean, we got to connect with so many of our citizens.
They're great.
It was amazing.
We have
So we're signed up for another one in April, right?
April 11th is the next one that you're helping out with, so, and then if any board members want to help at any of
It's
these events, be present, let me know, and we can always make sure that you guys have a logo shirt, a logo sweater, whatever it is that we need at that event to help identify homeless.
Is that the one that LAW is sponsoring?
No, they might, yes, they are. So it's the one at
Yeah.
Memorial Hall.
Yeah, yeah.
I gotta tell you, it was my first one.
Yeah.
It's impressive. It was impressive. And Carol,
Does it
She's
that
phenomenal.
my God.
Yeah.
I helped out during
Safe,
COVID,
yeah.
so.
But anyway, really impressive. A lot
Yeah,
of fun,
yeah.
actually. We had a good time.
Good. Anything else?
Question?
Anybody?
I just wanted her to give more of an update because this has been something the board has been requesting. What's the plan? What's the plan? And Chelsea's been putting in hours and hours for this. So we want to start sharing with it more
Good.
readily.
Good. Okay, anything else on staff reports? Any other questions of staff? Okay, we'll move
Thank you.
on. And the next thing on the agenda is closed session. Do we want to take that up now?
Yeah, we do.
In case you have to-
We want to get closed session out of the way,
Okay.
because we have some people waiting.
Okay, we're going to be going into closed session.
Probably about 30 minutes.
Hey, Sean,
Yes,
closed session being discussing
Yeah.
the financing stuff.
do we have Piper Sandler on?
We do.
Okay, yeah, so
Todd.
it'll be a number of things. So stay on, Steve. So keep Steve, Todd Van Meter, Grant Orbach, Donna, please, in closed. Would you please, Ryan? Thank you.
Me and Rich too.
Oh, yeah, the board members as well.
Yeah.
Thank you.
We'll be going into closed session and the first item A, litigation, anticipated litigation, significant exposure to litigation, conference with legal counsel, anticipated litigation pursuant to government code section 549, 56.9.
Clear the audience. He has to put people in waiting room before we start actually
Okay.
launching it.
But I still need to read this to the
You
public.
do? Oh, you do?
Yeah, because we're announcing what we're gonna discuss.
I'm
in
sorry to
closed
interrupt.
session.
I'm not the president. I should shut.
Yeah,
Yeah.
so then item B that we'll be discussing is hospital peer review and trade secrets, which is under Health and Safety Code 32106, reports involving trade secrets. So we'll be going into closed session. Thank you.
We've done this before.
I was waiting for you to bang a gavel.
No, I know.
You must, they didn't give me a gavel, they must have been scared.
She's got an arm's reach there.
Yeah, they must have been really scared to give me power.
We know, yeah. Grant, Donna, he's a 310 area code. I can give you his number. 310-447.
I think we're still recording.
Yeah.
Okay, we are completed with closed session with no reportable action. Now we will move on to item 10, which is new critical access hospital, skilled nursing facility bid review, award and resolution number 440. So open it for discussion, presentation by Sean.
Okay, we received two bids in the bid timeline. Both were responsible coming in at the bid timeline. We've got the reflection of the timeline here. So we are all good. Received a bid from Broward and from Modern. The bid came in at, there was a Modern's bid came in at 47,800,000 and Donna exactly number anyway. It came in at 47.8 and the Broward came in at 60. According to the requirements of the district as it relates to lowest responsible bidder. I'm gonna make a recommendation that we award bid to Modern. Discussion.
Any questions or discussion?
And make the motion.
Okay, motion by Ken. I second.
I think we need to read the title of the resolution,
Okay,
Okay,
Terry.
the title of the resolution is resolution number 440 of the Board of Directors of Seneca Healthcare District awarding construction contract for replacement of critical access hospital and skilled nursing facility project. And Ken has made a motion to approve letting the bid to Modern. And
I'll second.
And Jerry seconds. Okay, so Jerry, are all in favor?
Aye.
Rich can't vote. So Ken,
aye.
Shelley? Aye. Me, aye. Okay, so there we go.
So we'll sign it. Okay,
Okay.
thank you, board.
Sounds good. Glad to have that taken care of.
Oops.
Okay, 11 is our Chief Financial Officer report. And what, they got hold of you?
What time was that vote?
It was 3, well, we came out of closed session at 3:40, so it was probably 3:42.
Let's make sure that's in the minutes.
It's 3:42, just from 3:42, the vote was at 3:42.
What do you got?
The vote was at 3:41. We recess.
Yeah, let's take a brief recess.
How much time?
About what, 5 minutes?
Yeah.
About 5 minutes.
Okay, thank you.
Are we recording?